পয়েন্টারটা আছে, পয়েন্টারটা আছে, পয়েন্টারটা আছে, পয়েন্টারটা আছে। Can you read this labeling from a distance? Labeling to দেখা যাচ্ছে? This is the relation of the hip joint. All right. Above you can see the acromion process, the coracoacromial arch. This is subacromial bursa. Right. You see, it is an extensive bursa from below the coracohumeral arch up to the deeper surface of the upper part of posterior fibers of deltoid. This is the posterior fibers. This is the posterior fibers of deltoid, right? And this one is the anterior fibers of deltoid. So it is extensive, starting from below the subacromial bursa. It is extending up to the deeper fibers of upper part of posterior part of deltoid muscle, right? And this is the anterior part of deltoid muscle, this one, right? This is the acromion process, this is the coracoid process, from which you see two tendons are coming. That is, one is short head of biceps and another is the coracobrachialis. So two tendons from the tip of the coracoid process, that is the short head of biceps and coracobrachialis. In the exam you will be asked which one is lateral and which one is medial of the two tendons. Which one is medial and which one is lateral? Anybody? Always remember, coracobrachialis is medial and short head of biceps is lateral. Right? Just like ischial tuberosity, the muscles of ischial tuberosity, hamstring muscles. All right. Then you see, this is the supraspinatus muscle, and this is the pull of supraspinatus muscle. This has been shown by the extension of the supraspinatus muscle, that the direction of its pull. Right. Next, it is the infraspinatus muscle. This is teres minor. Supraspinatus, infraspinatus, and teres minor. This is the glenoid cavity. This is the joint cavity. This is the glenoidal labrum, that is the fibrocartilaginous rim around it. This is the synovial sheath, which is protruding out from the anterior border of the glenoid cavity and giving an extension as an Haversian or liquid fat, that is called the bursa. In a pouch, there is a subscapular bursa. This one is the subscapularis muscle. This one is the pectoralis major. This one is the pectoralis major. This is subscapularis. This is subscapular bursa. This is the capsule. The green one is the capsule. The red one is the synovial membrane. This one is the quadrangular space. This area is the quadrangular space. I have drawn in the scapular region. I have drawn quadrangular spaces, and have shown the passage of axillary nerve with its anterior and posterior division. All right, I have shown you. All right. So this is the quadrangular space where there is laterally the long head of triceps. Medially there will be shaft of humerus. All right. Below there will be teres major, and above there will be teres minor. Right. So here we see that branches of axillary nerve and axillary artery together with axillary vein. This is axillary vein, this is axillary artery, and this one is the axillary nerve. This is coming into the quadrangular space. This is long head of triceps. This is teres major. Alright. If relations comes, you should draw this diagram. There is some problem in our book that this part in our book, this part is drawn as trapezius. You will see this part is shown as trapezius. No. This is the anterior fibers of deltoid. This is shown wrongly in the books. So the relations are given. Now you have to describe in what is above, what is below, what is anteriorly and what is posteriorly in this way. Above is the supraspinatus, subacromial bursa, coracoacromial arch. Below is the long head of triceps, teres major and the axillary vessels and nerve. Anteriorly, this is anterior. This is anterior, this is posterior. Alright. Anteriorly there is anterior fibers of deltoid and the pectoralis major together with the subscapular muscle. Always remember, you see this one is the scapular plane, that is the ventral surface of scapula. This one, এটা আমি আঁকতে ভুলে গেলাম। এই ছবিটা একটু, this diagram has become a little subscapulary tendon is directly in front of the head of the humerus. Alright, and it is going to be inserted to the lesser tubercle. Right. So you will draw this diagram if relations are asked. Right. I have not drawn above, below, anterior and posterior. Please mark it. It is above, it is below. This is anterior and this is posterior. All right. Now, talk about the movements. Let us talk about the movement. In books, even in orthopedics, big books of orthopedics, there are some trouble in describing flexion, extension, adduction, abduction. There is some problem. It is confusing between one book to the other. All right. Now we need to follow at least one standard book so that we can define what is flexion, what is extension, what is adduction and what is abduction. Now, anatomically, what is flexion? Flexion means what? Anatomically, what is flexion? Flexion কাকে বলে? Anybody? Anybody? You want to tell what is flexion? No. In anatomical terms, this is demonstration. This is demonstration of flexion, not defining flexion. Towards the midline, please. Towards the midline. No. কেন এরকম করলে হবে না? এরকম করলে হবে না? ফ্লেকশন হবে না? Will not you call it flexion? This is not flexion. Anybody? What is the definition of flexion and extension? Flexion means when the body parts connected to the joint are opposed. Flexion means the body part that is connected to the joint are opposed. This is the joint. These two are the body parts connected to the joint. Then if you oppose these two surfaces, then it is flexion. Understood? Now what is extension? Extension, the reverse. When the body parts connected to the joint are taken far away from one another. Got my point? Now tell me what is adduction and what is abduction. What is adduction and what is abduction? In exam, no big thing is asked. In exam, no big thing is asked. Anybody? What is adduction? When the body part is carried to the midline, this is adduction, which you have been mentioning. All right. So when the body part is carried to the midline, this is adduction. So adduction will be this one. This one will be adduction. What is abduction? When the body part connected to the joint is taken away from the midline. So if it is adduction, then this will be abduction. If this is adduction, then this will be abduction. All right. Now, the muscles related to the flexion, extension, adduction and abduction. Flexion occurs in a plane. This is the scapular plane, body of the scapula, plane of the body of the scapula. This is glenoid. This is the plane of the body of the scapula. All right. Now, flexion and extension. You see, this is flexion. This is extension. This occurs perpendicular to the body of the plane. This is the surface of the body of the plane, and flexion and extension are occurring in this plane. So it is 90 degree to this plane. Yes or no? This is the surface of the body of the scapula, and this is the movement of flexion and extension. So it is perpendicular to each other. So flexion and extension occurs in a plane which is perpendicular to the surface of the body of the scapula. Right? Now, adduction and abduction. You see this one. Adduction and abduction occurs parallel to the plane of the body of the scapula. Adduction and abduction. This is in this direction. So this direction is like this. Adduction and abduction. This is in parallel to this body of the scapula. Yes or no? Adduction and abduction in direction. This is the body of the surface of the body of the plane of the body of the scapula. Body of the scapula টা এইদিকে. তাহলে এই লাইনটা কি হলো? Adduction abduction parallel to the plane of the body of scapula. Right? So flexion and extension perpendicular to the plane of the body of scapula, and adduction and abduction is parallel to the body of the scapula. Now the muscles concerned in this movement. Flexion is carried out by clavicular head of pectoralis major. Flexion is carried out by clavicular head of pectoralis major. Coracobrachialis, biceps brachii. Coracobrachialis, biceps brachii. Now extension is by adduction is both the anterior fibers and posterior fibers of deltoid together with pectoralis major, teres major, coracobrachialis and subscapularis. Coracobrachialis and subscapularis. Adduction is anterior and posterior fibers of deltoid together with teres major, coracobrachialis and subscapularis. Now abduction is 5 muscles. You should remember abduction is important. Deltoid, supraspinatus. These two are the prime mover for abduction. Deltoid and supraspinatus. Alright. Synergists are infraspinatus, teres minor. Write down. Eta jigesh korbe. 5 muscles for abduction. Deltoid and supraspinatus is the prime mover. Right? Synergists are infraspinatus, teres minor and subscapularis. Alright. Now this couple of forces that causes abduction. This is the subscapularis in the frontal plane. These two are the infraspinatus and teres minor in the back plane. These 3 muscles together with the supraspinatus spool and the action of the deltoid. These 5 muscles causes abduction of the shoulder joint. These 5 muscles causes abduction of the shoulder joint. Alright. Supraspinatus and deltoid is the prime mover. Infraspinatus, teres minor and subscapularis are the synergists. Now, how to demonstrate flexion, extension, adduction, abduction, medial and lateral rotation? কি করে দেখাবে? So, medial and lateral rotation occurs in a vertical axis that comes from the center of shoulder, humerus to the center of capitulum. Now, somebody show me the capitulum. Center of humerus head to capitulum. This is the vertical axis and the movement occurs around this vertical axis. Movement occurs around this vertical axis, that is medial and lateral rotation. Somebody please show me which one is the capitulum, which one is called capitulum. Whether anybody can show me which one is capitulum? Which one is capitulum? In the lateral part of the lower part of the humerus. What is? Capitulum means small head. Capitulum means small head. ঠিক আছে? In English, there are some method to make some word to represent smaller version of a big thing. That is putting let. L-E-T, let. Tablet. Tablet. That is the smaller version of tab. This is called tablet. Anyway, so whether somebody is able to show the flexion, extension, adduction and abduction, কেউ দেখাতে পারবে? Can somebody show me what is the flexion, what is the extension, what is adduction and abduction? You are right. This is flexion in this plane. Alright, this is forward and medially. Extension is backward and lateral. So this is flexion, this is extension. Done? Then adduction and abduction. Abduction is this one. Abduction is this one. That is forward and lateral. So adduction is backward and medial. This one is the adduction. Abduction is forward and lateral. I have asked one question earlier. Why the military badges are worn at the lower part of the deltoid? Military badge কেন deltoid lower part এ পরানো হয়? All right. None answered me. কেউ আমাকে আনসার দাওনি তোমরা। Adduction is done by pectoralis major. বলেছি আমি coracobrachialis, right? Teres major. All this comes for adduction, and for abduction, supraspinatus and deltoid posterior fibers. Middle fibers is not mentioned normally. All right, you see it, huh? You see it. My memory is not up to that I can recall. Now the range of movement, that is, in books it is written that, in some books it is written that flexion is up to 150 degree. I am not agreed to it. Extension is hardly 15 to 20 degree. Hardly it is 15 to 20 degree. Again, adduction is written more than 120 degree in some books. So this is not uniform in books to books. So I could not remember how much it is in each case. Now another question that comes is the elevation of the arm above the shoulder. How the arm is elevated above the shoulder. Now shoulder elevation is up to 60 degree. Shoulder elevation is up to 60 degree when there is medial rotation of the humerus. It is up to 90 degree in the plane of the body of the scapula. It is 60 degree when it is medially rotated. It is 90 degree when it is occurring at the plane of the scapula, and it is 120 degree when it is laterally rotated. And when it is laterally rotated, the head of the humerus rests on the subacromial bursa. When it is medially rotated, it is 60 degree. When in the plane of the body of the scapula, it is 90 degree. And when it is laterally rotated, it is 120 degree. Lateral rotation causes or avoids the impingement of the head of the humerus through the acromial process. Lateral rotate করে দিলে কি হবে? It avoids the impingement of the greater tuberosity to the acromial process. Otherwise, if you try to elevate this, greater tuberosity will impinge to the acromial process. Right? কটা বাজে? All right. And remember, for every 15 degree elevation, there is a question, also MCQ. MCQ comes. For every 15 degree of elevation, 10 degree comes from the humerus, 5 degree from scapula. That is, in 2:1 ratio, the humerus is elevated. 10 degree for every 15 degree, 10 degree from humerus and 5 degree from the scapular rhythm. All right. Now there is a component that is the sternoclavicular joint and the acromioclavicular joint. This component is subserved by the sternoclavicular joint and the acromioclavicular joint. At the beginning of elevation for 25 to 30 degree, this is only done by the supraspinatus. After that, the acromial end of the clavicle is elevated. This further elevation is carried out by the lateral end of the elevation of the lateral end of the clavicle, and as well as there is rotation of the clavicle at the sternoclavicular joint. ঠিক আছে? How do you see your watch? কেমন করে ঘড়ি দেখো তোমরা? Can you prove that the clavicle rotates? Can you show me that the clavicle rotates? Clavicle টা rotate করে দেখাতে পারো আমাকে? Anybody? What is the meaning of clavicle? Please? No. This is very interesting. Clavicle is the key. Clavicular means key. We need to open our box of our body. This is a human body. This is filled with anatomical magic, isn't it? So this box you can open, rotating a key, that is the clavicle. All right. Now, can you show me that the clavicle rotates? দেখাতে পারবে? Can somebody demonstrate that clavicle has a rotational movement? ঠিক আছে? You abduct your arm. How do you see your watch? ঘড়ি কিভাবে দেখো? You abduct your arm, right? Then medially rotate your forearm. When you do so, touch your medial end of clavicle. You will see this is rotating like this, inside the chest, entering inside the chest, then coming out. ঠিক আছে? ঘরে গিয়ে এটা টাচ করবে, করে এটা অ্যাবডাক্ট করবে, তারপরে এটাকে মিডিয়ালি রোটেট করবে এটাকে। ঠিক আছে? You will be able to palpate that the clavicle is rotating. Anyway, there are some applied importance about which. Number one, shoulder dislocation. Shoulder dislocation occurs. That is subcoracoid, subglenoid, infraclavicular, in such positions. All right. There is posterior dislocation of shoulder also. There is a term called recurrent dislocation of shoulder. What is that? Recurrent dislocation shoulder is there is a deficiency in the glenoidal labrum at the anterior part. There is a deficiency of the glenoidal labrum at the anterior part. This is known as Bankart's lesion. B-A-N, write down B-A-N-K-E-R-T, Bankart lesion. That is deficiency or gap at the anterior part of glenoidal labrum. All right, through which the head dislocates, and it occurs frequently, and some people can place back the head of the humerus to the glenoid cavity of his own, নিজে নিজে এটাকে আবার ঢুকিয়ে দিতে পারে glenoid cavity. They can push it back to the glenoid cavity through the lesion in the gap in the anterior border of the glenoid. This is the Bankart lesion. This is called, and there is operation also for this. Is Bankart's operation? There is an operation. All right. Now, another thing is painful arch syndrome or the rotator cuff syndrome. All right. There is tendinitis of the supraspinatus. There is chronic tendinitis of the supraspinatus. It may rupture at some time. And there is pain in raising the arm in between 60 to 120 degree. There is pain in elevation of the arm in between 60 to 120 degree. This is called rotator cuff syndrome or supraspinous tendinitis. Right? Another term is frozen shoulder. Another term is frozen shoulder. In this, the capsulitis involves whole of the shoulder joint. The capsulitis involves whole of the shoulder joint, and the shoulder joint becomes painful in any movement. It becomes painful in any movement. Rotator cuff syndrome and painful arch syndrome are given as a short note. These two things are given as a short note. So, shoulder dislocation, recurrent dislocation, rotator cuff syndrome and painful arch syndrome. Okay, we will continue the rest in the next class.